Alright guys, just getting started here in a second, letting everyone join here live on Periscope. We'll get started. Alright. Thanks everybody that's joining here on Periscope. We're live here in a functional medicine center in Pittsburgh, Pennsylvania, where we see patients around the world via webcam and phone consultations. So we're live here on Periscope, like I mentioned that. So people on Facebook, you're not going to see the hearts down here in the comments. Hello, the people on Periscope are giving. So people that are watching on Facebook, if I'm referencing or responding to somebody, it's the little things that you can see on Periscope that you're not seeing on Facebook. So today we're going to talk about a functional medicine approach to autism. Autism has grown by leaps and bounds in the United States. It's now estimated that around 1 in 68 kids are autistic. What was once rare is now commonplace. What was once just an isolated incident is now 1 in 68 kids. And the medical literature has a lot to say about autism, but it amazes me how few people want to talk about it. They're afraid of offending people, they're afraid of blowback, they're afraid of people, of hate mail. I don't see the negativity around it. I haven't met any child that has autism. If you ask them, are you okay with what you're going through? They're going to say, no, I love it. They're frustrated kids. They have issues. They want to feel healthy and normal, but they don't. They feel locked in their brain. They feel locked in their body. So, I mean, it's really down to just asking the kids that have autism. I haven't met any that are just saying, I feel great. I want to feel like this. They want to feel healthy and they want to feel their best. And autism, as it is really not their best. It is a health condition, and we need to not be afraid to call it what it is. And that's a far cry from being insensitive or rude or intolerant about autism, but then to say, well, it's fine, everyone should just be okay with that. You shouldn't be okay with any autoimmune spectrum problem. And that's what the medical literature is now finding out that autism is. It's an autoimmune brain problem. It's a neurological autoimmunity, or a form of it. It's somewhere on the autoimmune spectrum. And just like anybody that has an autoimmune spectrum problem, they find ways to manage their symptoms, to regain their health, reduce symptoms. That is what every other autoimmune spectrum problem does. Autism should be no different. So I thank you for the hearts down there, guys, to let me know that the connection's good and the audio's good and that you like the content as well. So we're going to talk about what the medical literature has to say about autism and what functional medicine has to say about autism. So this is all based on an article that I wrote for our website. Thanks, Kevin. So it's at drwillcole.com. Someone says there is always an answer. Sometimes you have to look in different places. Very well said. Very astutely said. I think that we need to look at the root issue. And really, what does the medical literature say about autism? And then how do we as functional medicine practitioners apply this in a practical way in people's lives? So again, we have patients around the world, and we're talking about these autoimmune spectrum problems, these autism spectrum problems, and how we regain health, brain health. So if someone is on the spectrum in some way, someone has other autoimmune problems, this is completely relevant to what you're going through. So the medical literature is very clear that autism is an autoimmune problem, to some degree an inflammatory problem of the gut-brain axis. Your gut and brain are inextricably linked through what's called the gut-brain axis, how your gut and brain communicate. Your gut is referred to in the medical literature as your second brain. It even looks like the brain. If you think about it, your gut kind of resembles your brain. So 95% of your serotonin is made in your gut and stored in your gut. So we need to look at the gut. Even if you don't have gut symptoms, well, many autistic kids do have gut symptoms, we have to look at the gut as a factor, a piece of the puzzle in them regaining function in their life. So we have to look at the brain as well. There's something called neurological autoimmunity, basically how brain the immune system can attack the brain, causing brain inflammation. So ruling out neurological autoimmunity as well as methylation impairment. So all of this is kind of back up a little bit. These are all epigenetic factors that we're talking about, environmental, lifestyle triggers. But what's the genetic predisposition here? Research has been very clear here that autistic kids have an increased rate of methylation impairments. So methylation happens 1 billion times every second in your body. And if methylation is working well, it's making for a healthy brain, making for a healthy gut, it's making for healthy detoxification pathways, and it's also protecting our genes, protecting our DNA. So when you have methylation impairments, you have tweakings of the genes that we're born with that make our body less likely to do things healthily and optimally. So our body's inhibited with making healthy brain and gut and detoxing and healthy hormones and protecting our DNA. So the medical literature is really looking at these gene mutations, these methylation genetic mutation or polymorphisms that are responsible for methylation. And autistic kids seem to have higher rates of these methylation impairments. Depending on the specific methylation impairment gene, each one does better with different courses of treatment. So we have to customize a comprehensive protocol, and that's what functional medicine really attempts to do, to really tailor a program for the individual, not sort of a one-size-fits-all approach. So we support the gene weaknesses, we support these underlying genetic polymorphisms, we support gut health, we support brain health, we support detoxification pathways, and then we come up with food as medicine. So let food be thy medicine and medicine thy food. This is Hippocrates, the father of modern medicine, said this thousands of years ago. And we realize now in the medical literature here, then the research is that food impacts autistic kids in many ways. So very commonly, and people are aware of being gluten-free and casein-free when it comes to autism and other autoimmune problems. But we want to find out what is right for the child, because everybody is different. So you have what's called molecular mimicry or cross-reactive foods that can mimic gluten to the body, healthy foods that maybe not right for the individual. Yes, there is an evaluation form on the website. You can go to drwilcole.com. So the first step's a free health evaluation via phone or webcam for patients around the world. And then if it's appropriate, after we answer your questions, we talk about your case, we give a functional medicine perspective on your case. Then the next appropriate, after the free health evaluation via phone or webcam, is going to be a consultation via phone or webcam. Or again, if you live in the Pittsburgh area, you would just come in here and see me personally. But honestly, the virtual webcam telehealth practice really gives people a lot of one-on-one personalized care. So we talk about autoimmune problems like autism, we talk about brain and digestive issues, we talk about autoimmune and hormonal problems. So this is a topic that's near and dear to my heart. It is affecting 1 in 68 kids. It's something that we need to talk about, we need to be bold about and not to be afraid about, and give parents, this information, because a lot of people don't know what's going on here and they want answers and they don't know where to look. And they're raising money for all these great autistic fundraisers and societies and charities, but ultimately, how are we applying this in a practical way to get these kids healthy and well and feeling like themselves again? I think that is something we need to talk about. And so, for more information about functional medicine, you can learn more about it at drwilcole.com. And again, you can follow us on social media if you want more information about that as well. All right, guys, we'll talk to you soon. I have to get with a patient pretty soon in about 15 minutes or so. So I'm going to get ready for the case, and we'll see you guys next time. All right, have a great day.